Welcome to the Wheel of Question, brought to you by Jazzability Productions. Let's do this! Hi everyone, and welcome to my first episode of the Wheel of Question podcast. Before I go on, let me introduce myself. My name is Jazz, and I am a physically disabled person who suffers from muscular dystrophy. So, naturally, my first episode of the Wheel Question is, what is muscular dystrophy? So, firstly, there are many different types of muscular dystrophy, and I will now name a few. Duchenne's muscular dystrophy, Becker muscular dystrophy, myotonic muscular dystrophy, limb-girdle muscular dystrophy, and facioscapulohumeral muscular dystrophy. These are some of the different types of muscular dystrophy, and there are a few more different types of muscular dystrophy as well. Now, muscular dystrophies are a group of inherited genetic conditions that gradually cause the muscle to weaken, therefore leading to an increasing level of disability. Muscular dystrophy is a progressive condition, which means it gets worse over time. But basically, as one gets older, they become physically weaker, and that is the nature of muscular dystrophy. Now you may wonder what causes muscular dystrophy. Well, certain genes are involved in making proteins that protect muscle fibers. So, muscular dystrophy occurs when one of these genes is defective. Each form of muscular dystrophy is caused by a genetic mutation, particular to that type of the disease. Most of these mutations are inherited. Now, some complications of progressive muscle weakness includes trouble with walking. Some people with muscular dystrophy eventually need to use a wheelchair because the muscles weaken so much they are unable to walk anymore. And also using arms. Daily activities can become more difficult if the muscles of the arms and shoulders are affected. Shortening of muscles or tendons around joint contractures can further limit mobility. There may be complications with breathing. Progressive weakness can affect the muscles associated with breathing because the muscles around the lungs weaken, therefore affecting breathing. People with muscular dystrophy might eventually need to use a breathing assistant device, such as a ventilator, initially to use at night time, but possibly also during the day. Other complications may include curvature of the spine. Weakened muscles might be unable to hold the spine straight, therefore putting pressure on your lower back and your upper back and on the shoulders. There may be complications with heart. Muscular dystrophy can reduce the efficiency of the heart muscle, therefore weakening the heart. There may be complications with swallowing. If the muscles involved with swallowing are affected, nutritional problems and aspiration pneumonia can develop. In this case, feeding tubes might be an option for you. Thinking about symptoms which may determine if you or someone you may know or anybody that may be diagnosed with muscular dystrophy. So, what are the signs and symptoms which typically appear in early childhood? Might include frequent falls. So, if you or someone you know is falling over quite often, that might show signs of weakness in walking or struggling to walk long distance. There may be signs of difficulties rising from a lying or sitting position, or trouble running and jumping. One may have a waddling gait, walking on the toes, or have large calf muscles. One can have muscle pain and stiffness. There may be signs of learning disabilities. There may be foot drop, which is quite common, or eyes not closing fully. So when you see someone going to sleep, the eyes are not fully closed. Kind of looks scary if you ask me, although it does give good scary effect for Halloween, like half open eyes, like a zombie. Right, moving on. And obviously, as I've mentioned earlier, curvature of the spine. So that basically means if you see someone who hasn't a straight normal spine, that may be a sign of muscular dystrophy. Of course, it could be a symptom of another disability that we haven't spoken about. Now, earlier in my podcast, I mentioned that I too suffer from muscular dystrophy. So, what type or what form of muscular dystrophy do I suffer from? Well, it's a rather long name, and it's called Facioscapulohumeral Muscular Dystrophy. Now, as you all know, it's a muscle wasting condition, and it's caused by a genetic mutation which switches on a gene that shouldn't normally be switched on. And the name describes the area where my type of muscular dystrophy usually causes weakened muscles. For example, fascio affects the facial muscles, scapulo affects the shoulder blade and the muscles around it, humeral affects the upper arm muscles. Sometimes the lower legs can also be affected, but with me, my lower legs and my upper leg and my hip and the pelvis areas, and of course the ankles are affected. So basically weakened muscles everywhere with me. Wonderful, eh? Now, facioscapulohumeral muscular dystrophy is one of the most common forms of muscular dystrophy. Experts estimate that between 3 and 5 people out of every 100,000 have this type of muscular dystrophy. In the UK, it is estimated that between 2,000 and 2,500 people have facioscapulohumeral muscular dystrophy. The earlier in life the weakness appears, the more severe it will eventually be. It is hard to predict how arm or leg weakness will progress, although in more than 50% of cases the legs are affected to some degree. Where this happens in early adulthood, it is unlikely that person will ever need a wheelchair. One fairly common feature of facioscapulohumeral muscular dystrophy is an asymmetry of weakness, where one side of the body is more affected than the other, particularly early on in life. This is often evident in the shoulders. It is also usually the right side which is first affected in right-handed people. The degree of weakness or disability can vary quite widely between different affected members in the same family, but it can show ever greater variation between people in different families. For some, it can result in weakness not only of the facial muscles and shoulder or upper arm muscles, but also of additional combinations from the neck, forearm, wrist, fingers, hips, legs, ankles, and the back muscles. About 10 to 20% of people with facioscapulohumeral muscular dystrophy eventually require a wheelchair. By contrast, up to 1/3 remain unaware of the symptoms, at least into old age. Although they may well have subtle signs of facioscapulohumeral muscular dystrophy, only noticeable to a doctor or a specialist. The majority of people with this type of muscular dystrophy come somewhere between these two extremes. Early weakness at the ankles can cause foot drop. In over 50% of people, some degree of weakness at the knees or hips develops by middle age. Together with weakness in the back muscles, this can result in a typical backward leaning and high stepping style of walking. In general, the people most severely affected tend to be the first members of the family to be diagnosed, and where the symptoms of weakness are evident from early childhood. The earlier in life the weakness appears, the more severe it will eventually be. It is hard to predict how arm or leg weakness will progress. Although in more than 50% of the cases, the legs are affected to some degree, where this happens in early adulthood, it is unlikely that a person will ever need a wheelchair. Now, can any other problems be anticipated? It's a good question. Well, in some cases, where symptoms of facioscapulohumeral muscular dystrophy start in early childhood, learning difficulties and epilepsy are possible. Also, hearing loss is common, but may not be symptomatic of the condition. Some people experience conjunctivitis and alteration of their cornea because of limited blinking and inability to close their eyes properly during the day and when sleeping. Using artificial tears and protecting the eyes during sleep may help. Specific problems with blood vessels at the back of the eye, usually called retinal vasculopathy, can occur, and although this rarely causes visual problems, it may be useful to have your eye checked out fairly often. Muscle pain is quite a frequent complaint in facioscapulohumeral muscular dystrophy, often in its early stages. This may relate to inflammation within the muscles, which seem to occur more in this type of muscular dystrophy than other muscular dystrophies. A physiotherapist can recommend mild exercises to help alleviate the pain. Treatment with single painkillers and anti-inflammatory drugs is common, but how much pain relief this gives can vary. Lung function is usually normal. However, in a minority of patients, weak breathing muscles may result in respiratory failure. This causes shortness of breath and nocturnal hyperventilation, morning headache, feeling sleepy in the daytime, not feeling refreshed in the morning, and dizziness. Patients with respiratory failure can be more likely to get chest infections. Patients with swallowing difficulties might also be at risk of aspiration pneumonia. If the breathing function is effective and if supplemental oxygen is required during a respiratory crisis, it must be carefully controlled and carbon dioxide levels must be monitored. Non-invasive ventilation, NIV, may be required. I myself use a non-invasive ventilation. I use it all night and up to a few hours in the day. Now, keep an ear out for a future episode about ventilation, and I hope to have some interviews from the ventilation team at Glenfield Hospital. So, hopefully that will be a good episode. So do keep an ear out for that one. It should be a good one. Assisted coughing with chest physiotherapy and breath stacking technique with an A and BU bag help to clear fluid in the lower airways during acute chest infections. Some techniques can help prevent problems when breathing may be difficult. A cough assist machine can also help. You may ask, at what age does Facioscapulohumeral Muscular Dystrophy usually become noticeable? In large families where several members have this type of muscular dystrophy, a person usually first becomes aware of muscle weakness in the teenage years or early adulthood. He or she may experience difficulty in raising one or both arms, or may notice prominent shoulder blades, or weakening or wasting of the upper arm muscles. In the more severe cases, difficulty moving the facial muscles, particularly around the mouth, can be evident by early childhood. This can be followed by weakness in the shoulders and upper arms. These children may experience progressive weakness of the legs by their teenage years and may need a wheelchair. By contrast, in the families less severely affected, people inheriting the condition may remain unaware of the symptoms until late adulthood. And does facioscapulohumeral muscular dystrophy affect life expectancy? Well, generally speaking, life expectancy is not affected. The exception could perhaps be in the most of the cases where not being able to move about much increases the risk of chest infection. Some recent reports suggest increased risk of heart rhythm disorders, but only in a few cases, and these respond to medication. Adults with facioscapulohumeral muscular dystrophy should see their GP or hospital doctor every few years for a simple heart check. What causes Facioscapulohumeral Muscular Dystrophy? Well, this chromosome contains lots of repeated pieces of the DNA called lethal-jigsaw repeat unit. They are arranged like a train of identical carriages. In someone with Facioscapulohumeral Muscular Dystrophy, the number of lethal-jigsaw repeat units is reduced, like a train having too few carriages. This causes a gene called DUX4 to be unnecessarily switched on and produce DUX4 protein. DUX4 protein is thought to contribute to muscle wasting, inflammation, and damage inside the muscle cells of someone who has facioscapulohumeral muscular dystrophy. Now, scientists are trying to find out more about the function of DUX4. This will lead to a better understanding of facioscapulohumeral muscular dystrophy and will help in the development of potential treatments. To some extent, knowledge of the number of DUX4 DNA repeats can indicate how severe the condition is and how it is expected to progress. How is facioscapulohumeral muscular dystrophy inherited? Our DNA is stored in structures called chromosomes. Every chromosome is part of a pair, one from your mother and one from your father. In facioscapulohumeral muscular dystrophy, one of the copies of chromosome 4 is faulty, so there is a 50% chance of each child of an infected parent to inherit the faulty copy, resulting in facioscapulohumeral muscular dystrophy. The children also have an equal chance of inheriting the good copy, resulting in no risk for those individuals or their future children of having this type of muscular dystrophy. This pattern of inheritance is called autosomal dominant. Now this is where things get a little more interesting. So you may wonder, is there always a family history of facioscapulohumeral muscular dystrophy? A person diagnosed with this type of muscular dystrophy, particularly in early childhood, may not have inherited it from either of their parents. This is called a novel mutation. More often, however, a person diagnosed with facioscapulohumeral muscular dystrophy will have inherited the faulty gene from one of his or her parents. It may be that there is a family history that had not been recognized before. This could be because the symptoms of the other family members had been very mild or they had been misdiagnosed. In some cases, where facioscapulohumeral muscular dystrophy develops in young children, who appear to be the first one in the family. One of the parents can show the same facioscapulohumeral muscular dystrophy mutation in some of their cells, but not in others. This situation in the parent may not give them any symptoms, but this does mean that further children of theirs would potentially be affected. It's recommended that both parents provide blood samples for a DNA study if they wish to know whether future children are likely to have this condition. In other cases, genetic testing may determine whether or not a young adult is affected. Family members or couples seeking further information should ask for a referral to the local clinical genetic service. Are men and women affected equally? Well, on average, men with facioscapulohumeral muscular dystrophy tend to show more weakness and from a slightly earlier age than women. The reason for this is not clear. Within large families, and excluding the most severe cases, women are more likely to be less severely affected and could be unaware they have inherited this condition. By the age of 30, nearly all males with this type of muscular dystrophy will show symptoms, but only 2/3 of females do. Will all family members be affected equally? Children inheriting the faulty gene are likely to be affected from a similarly young age and at least as severely as their affected parents. In large families, daughters with facioscapulohumeral muscular dystrophy might be less severely affected than their fathers. The age when symptoms begin and the severity of facioscapulohumeral muscular dystrophy seem to relate broadly to the number of these or jigsaw repeats on chromosome 4. This usually remains fixed within a family. Therefore, there would be some families where facioscapulohumeral muscular dystrophy will always tend to be quite severe, and others where it will always be relatively mild. Some people, particularly men, with average or mild presentations of this type of muscular dystrophy may, if they are the first cases in the family, have a mixture of normal and facioscapulohumeral muscular dystrophy type cells. Their children who will inherit the facioscapulohumeral muscular dystrophy mutation in all their cells will develop signs of muscular dystrophy earlier and more severely. The age at which this type of muscular dystrophy becomes noticeable is dependent on the number of these or jigsaw repeats on chromosome 4. Generally, the fewer these or jigsaw repeats, the earlier the age when facioscapulohumeral muscular dystrophy starts and will have greater severity. Yes, I know it sounds very complicated and confusing, but if you actually listen to it a couple more times, I'm sure you will understand it. If I have no symptoms, can I still carry the genetic fault and pass it on to my children? If the person has been affected from childhood, it is very unlikely that another relative, say a brother or a sister, who is unaware of any symptoms, could carry the faulty gene or pass the condition onto their children. The parents of the affected child are an exception, as they could be carrying the mutation but only in some of their cells. They could pass the condition onto more than one child. For people from families where several relatives or a parent has facioscapulohumeral muscular dystrophy, the DNA testing is the only way to find out if they too are carrying the faulty gene. In these situations, many people potentially affected may be affected only mildly, and are unaware of the signs and symptoms that would show a specialist that they have Facioscapulohumeral Muscular Dystrophy. Up to one-third of women carrying the milder mutations of Facioscapulohumeral Muscular Dystrophy, and a probably much smaller proportion of men may not show any definite signs or symptoms of the condition. Therefore, the answer to the question can only be given reliably by a DNA testing. Can one of my children have inherited Facioscapulohumeral Muscular Dystrophy and another not? If the apparently infected child is several years beyond the age or which the affected one first presented with symptoms, it is likely that they have not inherited the condition. This is particularly so if the affected child is the first person in the family to show signs of facioscapulohumeral muscular dystrophy, and DNA testing has shown that their condition has arisen from a new DNA mutation not present in a DNA sample from either parent. However, if either parent is affected or carries the mutation, the only way to be sure is to have a DNA testing. If the child has no sign of this condition, request for DNA testing would normally be refused until they are of an age, about 16 years old in the UK, to choose this for themselves. Is there any way of not passing the faulty gene onto my children? Accurate prenatal testing performed by Villus biopsy, or CVS, usually at 11 weeks pregnant, is now available to find out if the faulty gene has been passed on. Couples considering CVS should get in touch with their local genetic services. The DNA mutation causing Facioscapulohumeral Muscular Dystrophy can be recognized from a blood sample in most cases. The sample would need to be forwarded to one of the few molecular genetic laboratories able to analyze for this mutation. Unlike most inherited muscle wasting conditions, which are usually caused by a mutation of an important muscle gene, the genetics of facioscapulohumeral muscular dystrophy is very complex. This condition is caused by the production of the protein called DUX4, which I mentioned earlier, and this is not normally made in muscle. There are two types of facioscapulohumeral muscular dystrophy, the type 1 and the type 2. Both forms are caused by production of DUX4, but the underlying mechanisms that lead to its activity are different. DUX4 is a so-called transcription factor that switches on genes that are normally not active in the muscle cell. This is toxic for the cell and can lead to its death, resulting in muscle wasting and weakness. There are no cures for facioscapulohumeral muscular dystrophy or any specific drug treatment. Regular exercise, especially hydrotherapy, helps keep people moving and to manage pain. It is essential to keep your weight down through diet if necessary to reduce stress on already weakened muscles. If you're exercising to increase muscle strength, build your exercises up gradually. Can orthosis help? The use of orthosis, devices that support the feet, can be helpful for people with this condition. They frequently include the most common features, such as foot drop and shoulder weakness. After your physiotherapist assesses you, ask to be referred to the orthotic team. They will guide you which orthosis will help you. Can surgery help? The scapular muscles, which attach the shoulder blades to the chest, are often very weak with Facioscapulohumeral Muscular Dystrophy and can make lifting the arm difficult. The operation of scapular fixation, fixing the shoulder blades to the ribs at the back, has enabled some people to regain more use of their arms. Because people with facioscapulohumeral muscular dystrophy may not be moving their arms or legs much. This could make these muscles weaker. It is advisable to have a combined assessment from a neurologist and an orthopedic surgeon first. If the eyes become inflamed because they remain open at night, and artificial tears alone don't help, it is possible to have surgery to bring the eyelid closer. What is the risk of anesthetics? There is no known risk, but some patients with facioscapulohumeral muscular dystrophy can experience increased sensitivity to sedatives, such as inhaled anesthetic and drugs that relax the muscles, for example, neuromuscular blockers. Make sure the anesthetic is aware of your diagnosis before any operation so they know how to look after you after the operation. This is especially so for people whose lungs don't work as they should. Local anesthetic and nitrous oxide are safe, for example in minor dental procedures. It is also helpful to carry an facioscapulohumeral muscular dystrophy alert card and a care plan, both of which contain information to alert emergency services and other healthcare professionals of the specific issues that affects you. Now, I was diagnosed early with muscular dystrophy. I think I was about, maybe about 5, 6 years old, and there were signs of me walking on my toes, and my eyes wouldn't close properly or fully, and my eyes were always watering. So I often was taken to my GP, and they didn't have a clue, and they passed it on to the hospital doctors and so on. And this was back in the days when I'm not sure if they realized what type or what kind of muscular dystrophy I had. I often remember being taken to Hammersmith Hospital in London a few times, where I had some, I don't know how to call it, but I would say experiments. I had like electric shock treatment on my muscles to see how they would react. I had like little minor operations where they pulled some muscle tissue out to test, and so on. I've had 7 operations altogether, and one thing I've noticed that after each operation, I seem to become physically weaker, a bit more than usual. Yes, I mean, each operation obviously helped me in some ways, like I explained earlier in this podcast. But yeah, as I said, gradually I got weaker from each operation from my time in hospital. And yeah, I was basically able to walk till I was about, I don't know, 16 years old, maybe 17. And then it sort of became too dangerous for me to walk because as I was walking, my upper body was leaning more backwards, and I couldn't really see where I was walking towards or where I was going. So it naturally became dangerous for me to walk, and I was actually falling over quite a lot. So then, yeah, I ended up in a manual wheelchair, and which I could, push my own manual wheelchair by myself at that time. And over the years from then on, I still got weaker and weaker until I couldn't push my own wheelchair anymore. And then I had to rely on other people to help me get around in my wheelchair. And that went on for a few years until I managed to get my own powered wheelchair, which made me more independent, more mobile, that I could get around without, relying on others. So since then, I have become physically weaker, and I have had to now rely on carers to help live my life, basically. Now every morning I need help getting up, getting ready, and so on. There was a time when I could do that myself, but now I have, like I said, I've gotten physically weaker more and more, and this is what muscular dystrophy does. And since, as far as I'm aware, I am the first born with muscular dystrophy or Facioscapulohumeral Muscular Dystrophy in my family, I'm not aware of anyone else, like my grandparents or anybody before them, my great-grandparents or great-great-grandparents and so on. I'm not aware of any of them having, this type of condition. I know my brother and my sister don't have it, my nieces and my nephew do not have it. So I would what you say, I have it quite severely because I am the firstborn. And as I explained in the podcast earlier, if you are the firstborn, you will have it severely, and so on. So that's been my experience so far. And so how have I gotten through it mentally? Well, at times it's been challenging, I won't lie. There has been ups and downs, But what I will say is always try to keep a positive mind as much as you can. Always try to think positive. Always try to do your best. Never ever think that you can't do things, because you're getting physically weaker. Because there are carers out there to help you, Look at me. I had my own Motability car, which is heavily adapted. It had no steering wheel, so people wonder how I drive. It's cruise controlled, and it's an amazing piece of technology. And I love driving. It gets me everywhere and anywhere I want to go. You know, so it had made me tremendously independent. And without that, I don't know what I would do. So, you know, there are positives in my life. Always be brave. Always take a challenge head on. Do your best. You know, and just do as much as you can, really. And just always, you know, never think that you can't do anything. And, you know, just get on with life, basically. That's what I would say. And, yeah, enjoy it as much as you can. Because, after all, life is short. Now, I've come to the end of this episode. So, I want to thank you so much for tuning in to my podcast. I hope you enjoyed the show and were able to take away something valuable. I want to remind you to follow me on my social media network to stay connected. At Facebook, you can find me on The Wheel Question. On Twitter, you can find me on Wheel Question. On Instagram, you can find me on The Wheel Question. Or you can simply email me at thewheelquestion@gmail.com. Keep engaged with me online, as I would love to hear from you, and who knows, I might even reply. Your follow, likes and shares makes all the difference, and really help to build up this podcast and help it grow. So please spread the word. I would really appreciate it. Also, please subscribe to my podcast so that you'll be notified when a new episode is online to listen to and enjoy. And also check back soon for more episodes. Until then, stay safe and thanks again for listening.